Thank you, Mr. President. I rise consistently with my colleagues, Senator Washington, Senator Kitchen, Senator Farnese, and others to speak in opposition to this bill. We had a relatively early interaction on the Gosnell situation when we first heard about it. I can't remember the exact date, but if I remember correctly, Senator Vance and I held immediate meetings with the State Departments of Health and Departments of State to discuss the situation and to figure out what was going on and what was the lack of activity. And as continued from that moment, from that early conversations that occurred in my office, occurred in other offices, Senator Vance's office being one of them, we've tried to address the failings that allowed that situation to occur. But quite frankly, Mr. President, I don't know if there's anything that anyone could have done to prevent Kermit Gosnell from performing the atrocities that he performed. I've said this before, and I will say this again, that Kermit Gosnell was way out of the bounds in terms of what he did to hundreds, if not thousands, of women on almost a daily basis. Way out of bounds. There is no situation anywhere else in the Commonwealth, nor probably anywhere else in the country, that comes anywhere close to what Kermit Gosnell was doing. And as a result of the legislative activity over the last several months, now we're in a situation where we are not responding to the Gosnell situation. Because, quite frankly, probably no one could have responded to those atrocities. No matter what the law is, was, or will be in the future, his behavior would probably continue because of his, at best, failings as an individual. Now we're in a situation, as my previous colleagues have said, voting on legislation which could very well close down quality health care service delivery systems in neighborhoods who need them the most. Now we're in a situation where we may be about to pass legislation that would only create a worse environment for women to get quality health care services. What's performed in these facilities is not just abortion services. What's performed in these facilities, as was stated earlier, Mr. President, are cervical testing, pap smears, other reproductive health care services, other kind of health care services that these facilities have provided for decades without any significant problem. And now we're in a situation, we're creating a barrier so high for them to perform those services that more than likely they'll have to shut down. And the women who need access to these services so badly will not be able to have access to them. So here we are, responding to an issue, or allegedly responding to the Gosnell issue, when in fact what we're doing right now, if this legislation becomes the law of the Commonwealth, is denying women, its effect will deny women the access to quality health care services, because the facilities that historically had provided them with no problem will probably be forced to shut down. And I would hope that that's not really what we wanted to do. I would hope that at some way, shape, or form we can figure out a way around this and figure out some other methodology to make sure that the women who need these services the most get access to them. Get access to them, and access being an important word here. But Mr. President, if we claim that we want to provide health care services, quality health care services, accessibly, affordably, and affordability is a direct connection to accessibility. If we claim we want to provide those services to these women, then we should not be voting for this bill, because the effect of this bill will shut down those services and make them inaccessible to the women who need them the most. This is not a response to Gosnell. This is not a response to Gosnell and Kermit Gosnell's situation. This is an attempt, unfortunate attempt, if you will, at best, to shut down women's access to all kinds of reproductive health care services. And that's not right, and this bill and these women deserve a no vote from this body. Thank you.